The AMA just told every medical school in the country, teach your students AI. But here's the problem. Most programs have no idea where to start. And most students have no idea what they're supposed to learn. So this video fixes that. Hello everyone, my name is Rupen. I'm an oncologist, and over the last 3 years I've been teaching myself AI, and right now I'm pursuing courses in machine learning from Stanford. Today, I'm going to give you the single most important introduction to AI in medicine that exists. This is not a fluff, this is not a hype, this is the stuff that you actually need according to the American Medical Association. I have to disclose I'm the founder as well of MeDucation AI. It's a medical education company that integrates AI in medical education, in residency programs, medical schools, and fellowship programs. The following video, we are covering 3 things. 1, what AI actually means in clinical context. 2, why it matters for your training right now. And 3, the specific competencies you need to build. So if you're a medical student, or a resident, or a fellow, or even a program director, this video is your starting point. Now, let's start by definitions. And you don't need any computer science degree for that. Let's define artificial intelligence. What is artificial intelligence? Artificial intelligence is any system that performs tasks that would normally require human intelligence. In medicine, we're not talking about robots replacing doctors. We are talking about software that can actually recognize patterns in data. Patterns that are too complex or too numerous or too subtle for any human to catch consistently. And here is the thing. The American Medical Association doesn't use the term artificial intelligence. They use the term augmented intelligence. And that's deliberate. They want to frame AI as a tool that enhances the physician, not one that replaces them. And that framing matters for how you will interact with this system. Personally, this is something I completely agree with. I don't think and I don't see AI replacing human physicians. I see AI augmenting our skills of taking better care of our patients. I practice every day using different AI tools, and AI makes me a better physician. Now, when we talk about AI or augmented intelligence, there are key subcategories you need to know. First, let's define machine learning. Machine learning, these are the algorithms that can learn from data to predict an outcome. And these have been used in medicine for so many years. And we use it every day. You might not know about it. The way that we estimate the glomerular filtration rate based on creatinine and other variables, this was created with a linear regression model that it is a subtype of machine learning. The second important definition here is deep learning. Deep learning is a subset of machine learning that uses neural networks within many layers. Then we have natural language processing. Natural language processing is an AI that understands and generates human language. And here we think about like ChatGPT or Claude from Anthropic or Claude from Anthropic. But also think about it as the clinical natural language processing, the one that extracts diagnosis from physician notes. And then we have big data. Big data, it's the most important fuel of all this revolution. Think about the electronic health records, the genomic database, imaging repositories, claims data. The AMA's first module is built entirely around understanding how big data drives AI in healthcare. And what most people miss is that AI in medicine is not a one thing, it's a spectrum. On one end, you have the rule-based clinical decision support, the kind that has been in electronic health records for years. I'm sure you all interacted with a sepsis algorithm in your electronic health records that predicts a sepsis based on some variables like temperature and white blood cell count. Also, the drug interaction alerts, these are as well AI systems, but also it goes from that spectrum to the spectrum that generate language and even generating images. Your job as a physician is to understand where on that spectrum every tool you use falls, and what that means for how much you can trust it. Now, you would be wondering why the AMA adopted these mandatory changes right now. Right now, we are not in the phase to ask ourselves, should we allow AI in medical education? Right now, we are in the phase is, how do we regulate the use of AI in medical education? Medical students, residents, and fellows, all of them are using AI in one way or another, either summarizing PDF documents or creating exam questions or even generating images or flashcards, and even in clinical decision support. A medical student might go to an AI tool and ask a question about the diagnosis of a patient they have seen. And if the medical student can't catch hallucination, can't judge what is an accurate answer and what is not an accurate answer, and if they don't even know that the possibility of hallucination exists, they can harm themselves and their patients as well. So it's very crucial to embrace the AMA guidelines right now. In November 2025, the AMA adopted a policy that fundamentally changes medical education. And now let's talk about this policy. First, the AMA will develop and disseminate model AI learning objectives and curricular toolkits. That means there will be standardized learning goals that every medical school must be expected to address. Second, they will collaborate with accrediting bodies and other medical organizations to formally recognize AI literacy as an essential element of medical training. Third, they will advocate for funding and faculty development resources to make this happen. Because here is the uncomfortable truth. Most medical school faculty don't know AI either. So the problem is you can't teach what you don't know. But here's where it gets interesting. This isn't just about medical schools. The AMA wants AI training across the entire continuum: undergraduate medical education, graduate medical education, and continuing medical education for the practicing physician. Now, let's talk about the 3 tiers of AI competencies that you need. One is the foundational skills. This is the minimum that you need to use AI, and it covers 4 areas. First is prompt engineering. I'm sure everyone uses prompt engineering in one way or another. Anytime you interact with an AI tool, you have to give it a text, you have to present your request, and according to that, the AI will generate an answer. And that is called a prompt. It's the piece of text or data that you provide to the AI. And this could be in the form of question or in the form of image. The way that you phrase your prompt affects the AI's answers. For example, if you ask, what is the treatment of colon cancer? The AI will frame something that is used for the general population. It will think that it's answering a patient. However, if you go to the same AI tool and say, I'm an oncologist, and then you ask, what is the treatment of colon cancer? The response generated will be very different. And now there is an emerging field called prompt engineering. It means how we can talk to AI in our own natural language to let the AI do the things that we want. You can't just throw any text on the AI and expect it will do the things that you want. To create a certain outcome, you have to know how to guide and prompt the AI. Second, let's talk about human-AI agent interaction. But first, let's define what is an AI agent. An AI agent is a large language model or an AI tool similar to ChatGPT from OpenAI or Anthropic that released Claude. However, this large language model has also the ability to access and use tools. What do I mean by tools? Large language models in this day and age, they don't only generate language, they are able to take actions on your behalf. And by actions, I mean, in the digital world, a large language model can open a browser and edit a text and search the internet and get queries and even sometimes place orders on your behalf in your shopping cart. When we give these large language models tools to be able to execute in the digital world, this is what we mean by an AI agent. So understanding the human AI agent, it's important a skill in one of the foundational skills. Third is security and privacy awareness. HIPAA doesn't stop just because using AI. Actually, understanding HIPAA and how your data travel when you use AI is very important. Most of us interact with large language models, and when we type the queries into large language models, our data is leaving our hospital. They are going into a second or third party company. The third important part is security and privacy. HIPAA doesn't stop just because using AI. It's very important to understand when you use AI, specifically large language models, and you type queries, your data leaves the hospital and the clinic premises and goes and processed in another company. This company might store your data in your own country or another country. And this can bring lots of legal issues and privacy issues if you don't understand the consequences of what you share with these large language models. The fourth important part in the foundational skills is the clinician-patient interface. Most clinicians in this day and age use AI scribes or use clinical decision support tools like Doximity GPT or Open Evidence or UpToDate or Heidi's AI Evidence. And when you use these tools to make our decisions, or we use AI scribe tools while we're taking history from a patient, it's very important to know that we have to disclose this to the patient and also take their consent, because their sensitive data is being shared with this AI note-taking tools and clinical decision support tools. Now, let's talk about tier 2. These are the intermediate skills that a physician needs. And here we have 3 important intermediate skills. 1 is bias detection and mitigation. 2 is the interpretation and the explainability of the outputs of the AI. 3 is the effective integration of AI into the physician workflow. Let's talk about bias detection and mitigation. AI models are as good as the data that they are trained on. However, remember that most human research has some sort of data. Most clinical trials are usually biased toward one human race or another, depending on the country where this clinical trial was conducted. Also, on the other hand, there might be some types of bias that we can't control in our research. Large language models are trained on this research, and you will notice when you interact with them, there might be some bias in their recommendations and the way they answer your questions, specifically if you're asking about an unrepresented population in a specific disease. For example, I do research about the use of AI in clinical decision support in oncology. And I noticed when I asked AI tools about the treatment of breast cancer in male patients, their accuracy dropped significantly. And sometimes they even ignore that I'm asking about a male patient. They answer me as they are treating a female patient. The second important thing in the intermediate skills is the interpretation and the explainability of the AI outputs. In this day and age, we are able to look how the AI think. Think about it as if you have a human being who's playing in a guitar and they are being monitored by an MRI machine. You are able to see the areas of their brain that light up on that machine, and you can recognize an association between the area of the brain and the movements that are being conducted or the emotions that are being felt. The same applies to large language models in this day and age. For example, in radiology, there is a huge use of AI in image interpretation, and attention maps also help to understand how the AI look at specific image and interpret the results. The third important part in the intermediate skills is the effective clinical integration of AI in the workflow. Knowing an AI tool exists is one thing, however, knowing how to integrate it into the clinical workflow without disrupting patient care or creating an alert fatigue or introducing errors, that's a real skill. I work with lots of startups, and I notice that sometimes they might introduce a solution for a problem. However, that solution does not align with the physician workflow, and it might lead to the physician to take extra steps to achieve a certain outcome. As a physician, it's very important to understand how you can use the AI tool within your workflow without affecting patient care. The third tier of skills are the advanced skills, and these skills are about leadership. And these skills cover 1. Ethical governance, 2. Regulatory strategy, and 3. Model lifecycle management. Let's talk about ethical governance. Understanding accountability and liability when AI is involved in clinical decision is very important. It's very important to understand who is responsible when AI recommendations leads to harm. The second is regulatory strategy. Understanding the regulatory landscape of AI in healthcare is very crucial. For example, the FDA released recently certain rules that clinical decision support tools should follow before they are used in the clinic. The third important advanced skill is understanding model lifecycle management. Large language models are trained on a certain data, and they have a cutoff after training. The reason is training large language model is very expensive. You will notice that third-party companies train large language models on the internet data until a specific date cutoff. And if you ask a question that falls beyond this cutoff, the AI tool or the large language model is going to do an internet research to find your answer. And understanding when the AI tool does the internet research versus answering you from its training data is very important. It's very important to detect bias and hallucinations. So let's bring it back to where we started. The American Medical Association has made AI literacy a formal requirement across medical education. That means every medical student, resident, practicing physician needs to build a competencies across 3 tiers: foundational, intermediate, and advanced. This video is the first in 12-part series that cover every single one of these requirements. I built this series so that program directors can point their student here and say, hey, watch this. Because right now, there is no single comprehensive free resource that walks through all of this. If this is useful to you, please subscribe. Because the next video will break down exactly how machine learning, deep learning, and natural language processing work in the clinical context. You don't need a computer science degree. And if you want to see an AI-powered medical education tool in real life, check out MeDucation AI. We are building exactly what the AMA is asking for. I will see you in the next video.